Concili Incorporated is Nevada's premier Democratic campaign firm, fighting for progressive issues and candidates for over a decade, and proud sponsor of Battle-Born Progress. One APIA Nevada is a grassroots nonprofit organization that advocates for policies empowering everyday Asian Pacific Islander Nevadans. Nevada is home to a growing APIA community, accounting for 1 in 10 voters. We are One APIA Nevada. Tonight's episode of Out in Front is brought to you by our season sponsors, Concili Inc., Nevada State Education Association, One APIA Nevada, Silver State Voices, and Stefan and Marta Schmidt. As well as our episode sponsors, Save Lives Nevada and Washoe Education Association. One APIA Nevada is a grassroots nonprofit organization that advocates for policies empowering everyday Asian Pacific Islander Nevadans. Nevada is home to a growing APIA community, accounting for 1 in 10 voters. We are One APIA Nevada. Concili Incorporated is Nevada's premier Democratic campaign firm, fighting for progressive issues and candidates for over a decade, and proud sponsor of Battle-Born Progress. Tonight's episode of Out in Front is brought to you by our season sponsors, Concili Inc., Nevada State Education Association, One APIA Nevada, Silver State Voices, and Stefan and Marta Schmidt. As well as our episode sponsors, Save Lives Nevada and Washoe Education Association.
Welcome back, everyone, to Out in Front. My name is Annette Magnus, and I'm the Executive Director of Battle-Born Progress. Thanks again for joining us tonight. We had a little change up in schedule, and we're so excited to have Clark County Commission Chair Marilyn Kirkpatrick joining us again tonight. She's back to talk about all things county, the American Rescue Plan, vaccines, all of that good stuff. We've been doing a tremendous amount of work with her over the past few months to make sure that the community is getting vaccinated. And now we're going to talk about that and more. So, Commissioner, welcome back to the program. Thank you so much for all of your hard work over the past few months and, educating people about vaccines and the importance of getting vaccinated, and also reopening our community and trying to make sure that, Las Vegas is still a place that people can come to, but we're safe. So thanks for joining us again.
Thank you. And thanks for the opportunity. Anytime that we can educate folks on the truths, I'm happy to be part of it.
Awesome. Well, tell us what you've been working on at the county. I know we've got some specific questions for you, but I know our viewers are really curious statewide about what is going on in our communities as it relates to COVID relief right now. And what has the Clark County Commission been working on?
So here's what I'll tell you about Southern Nevada. We've been working pretty hard in Southern Nevada. You'll remember that we around July, the end of July, we asked employees to start wearing masks. And then the CDC came down with masks. So at that point, we were 18.8 in positivity rate. I'm happy to say today we're at 13%. So we are trending in the right way. Our sewer signs, our data shows we're also trending for the next 2 weeks in the right way. So right now, what's taking a lot of our time is to ensure that the kids are safe going back to school, that the staff is safe. And so we've been working in partnership with Clark County School District to ensure that we can keep kids in school and keep our staff safe.
Absolutely. And I know the questions are already starting to roll in the chat. So if you all have questions on Facebook, on Twitter, or on YouTube, we want you to ask your questions of the commissioner tonight. We'll get to all of those questions later in the show. And make sure you're sharing this on your Facebook page, but also on your YouTube and Twitter pages so other people around the state can watch with us tonight as well. All right, Commissioner, I'm going to get to a few of my questions before we get to the audience questions. So the first thing I wanted to talk about were the American Rescue Plan listening sessions that you all have been holding. So you've hosted many listening sessions where you solicited input from the public regarding the American Rescue Plan and that funding and what we can do with it, what we should be doing it. Can you give us a picture of what the most common questions and concerns that the community seems to have regarding this funding?
So really, people want to know how we're going to spend it, what our priorities are, and really we're asking them what their priorities are. And I can tell you that affordable housing for all populations rises to the top, from our seniors down to our young single parents. Want to know how are they going to be able to stay in their home or stay in their apartments, because rents are rising at a ridiculous amount. So that's why we set aside about $165 million towards affordable housing. And that is all different types of housing. So that's for rent, that's transitional, that's for sale, so that we can ensure that we can have housing that's available to everybody. Some of the other things that came up were mental health. People want to know what we're doing with that, public health. And then really people want to know what are we spending for homelessness? And that really falls into our affordable housing concept.
So let's talk about evictions and what's happening with evictions right now in Clark County. How can people access funding? I know there's still quite a bit of funding left out there because of the American Rescue Plan and other things as well, those CARES dollars and things like that. How do people in Clark County access, services if they're being faced with eviction, like we know many people in Clark County are?
So really, we've kind of changed the process for the long term, which I'm super excited about. So we work directly with the courts. So if somebody is facing eviction, we remind them to please respond. In lieu of going to court, they'll work with legal aid and they'll work with the court system. And us will be able to pay down the debt that is owed. But we also have the other track where you can get into the CHAPS program, and we encourage people to do that. We have about 5,000 on the waiting list, and we're processing about 1,000 applications a week. So we're well into the folks that applied in May. and will continue. So we know that in June and July, there was a big uptick. We also have a requirement from the state's money that we have to spend down over 60% of our housing dollars that we set aside for rental assistance by 1 October. And we are definitely going to make that. And we definitely are one of the few states in the country that actually was able to get their money out. So to give you an example, in California, they've only been able to get out less than 20% of their dollars, where we are well over 50% of our dollars. We've actually gotten it out and gotten it to residents.
That's great news. So if people need to apply, just to remind them, if they're struggling with housing right now, if they're struggling to pay their rent, how do they apply? Where do they go on the county site? What do they need to do? Just go through that process again so people are really clear on how to do that.
So I want to point out two things, because I spend a lot of time telling landlords that if you evict them today, you're not going to get your back pay. So it's in your best interest to keep them, because we can pay up to 15 months of back pay for the rental assistance. However, we encourage people to go to the CHAPS portal on the Clark County website. If your landlord goes, we encourage the landlord to go in and put their information in. That expedites the process. And like I said, it's a fairly easy, there's 7 documents that you have to be uploaded. I always say, call our office if you're struggling with uploading those documents, but we have more than enough money to accommodate a good 15,000 more people. So please don't hesitate and go and fill out the documents so that we can help you. And the landlords have been fairly good for the most part once they learn that there's no incentive to kick them out.
That's good to hear. Okay, I want to come back to the question that I just asked as well, and say, of the concerns that were shared with you from the people in Las Vegas, Clark County, which were the most surprising to you, and how is the county adjusting its plans to make sure the concerns of the folks in Clark County are being addressed?
So what I can tell you is one of the good parts about the ARPA money is that you have to focus on the census tracts that have been hardest hit. And so those typically have been our poorest neighborhoods. And so it's an opportunity for us to go in to give access to healthcare, because we know that they were hit very hard. So we are looking at a full wraparound services for our community, and it's a once in a lifetime opportunity to get it right and to sustain it for the long term. And we believe that we can do that. But really, housing was number 1, access to healthcare was number 2. Economic development really didn't rise to the top. But we set some dollars aside for those smaller businesses that could not get any of those loans. But really, it's the social service component that folks need help with.
Yeah, that makes sense. So, given that the listening sessions have generated a pretty wide variety of feedback, like you were just saying, what are you doing to ensure transparency in that process of how the ARP money is going to be spent? And I know this week you talked a little bit, I think I heard it released, there's different buckets of money that are going to be out there, but how does the public know where those dollars are going, and how do they stay involved with this process to ensure transparency?
So the great thing is, for Clark County, this is not new to us. We did it with CARES. We put it in a separate account, and then we divided it by the bucket. So the federal government requires a quarterly audit. So we'll be able to show where those dollars were spent every quarter. And we plan to have them before the county commission so that people can see specifically what things did we work on, so that money is safe. We have 5 years to spend it all, but we had to submit a plan, and we submitted a plan with those 6 buckets to enhance it. And we'll be going in now. We had several hundred applications. So we'll be going in and scoring them and see how do they fit within Clark County's programs today, so that we can sustain it for the long term.
Awesome. So what is your recommendation for people staying involved with that process? Because obviously, Clark County residents need to know where that money's going. They should be involved with the process. It's, frankly, our tax dollars coming in from the federal government. So what do you recommend for them staying involved in all of those ARP dollars being distributed?
So what I would tell them is to watch for the county commission meetings, and we can make sure that you get a link, Annette, so that we can show you each month when we have, each quarter when we have our audit, so you can start to see where our spend is. Clark County was one of the few counties and state. We spent $196 million on people, and that's what we want to continue to do. We want to spend it on people and help them better for the long term, but we're happy to share that information. So quarterly, you can expect, I would say mid-October will be our first report. And if you're engaged with a nonprofit and you want to know how that process is working, those dollars probably will not be expended until the first of the year, only because we want to make sure what everybody's needs are and that we can have a long-term sustainability on it.
Yeah, that makes a lot of sense. So I want to stay on the ARP just for a few minutes and talk specifically about combating climate change. Obviously, we have fires raging in the West right now. Our brothers and sisters up in Northern Nevada are disproportionately being affected by the smoke and the wildfires and all of the things that happen with that. We've even seen some of that here in Southern Nevada with the smoke, and climate change obviously is impacting us with our water and other things like that. So are there any plans to put in place around the use of the American Rescue Plan funding to mitigate air pollution or climate change? And what about the possibility of investing some of that money into our local parks or public lands?
So great question. We've been doing that for about 4 years already. That Commissioner Jones, that is really something he's taken the lead on. We both serve on the Water Authority. So Commissioner Jones and Commissioner Gibson and myself. And so we've already been working towards securing our water for the long term. Senator Mastis worked very closely with us on the infrastructure bill that will allow Southern Nevada Water Authority to work on some big water projects. But we are doing things already as far as taking up some of the grass, having the county codes match the Water Authority codes, so that we're more cohesive of what we're doing, but we're also looking at our own. So we're putting in EV stations across Clark County. We're working on redoing some of our parks and our public lands so that we can keep them cleaned up and keep them safe. And I'm fortunate enough, I sit on the Western region for all the counties in the West, and really water is a hot topic. As you know, today, Tahoe is experiencing their fires themselves. So we know it's an issue, and we're doing everything that we can, even outside of ARPA, to be prepared in our rural areas, especially, but long-term for Clark County.
That's great news. So, overall, the federal government obviously has started to move this money. What are the next steps in the ARP process for the state? And why are these funds so critical to a place like Clark County right now?
So I don't know what the state's next process is. Apologize for that, but I do know that they're on a 75-stop listening tour. And we also know that they put $1.1 billion into lost revenue just last week, which is about half of their dollars. But in Clark County, our next steps are, so we received $220 million, and we have to wait 1 year for the next $220 million. So with our $220 million, our immediate needs are wraparound services for our constituents. There are many people that have COVID today that will be long haulers, and they'll need long-term care. And we have lots of those in our community. Unfortunately, right now, we're having to spend a little over $10 million to keep up with testing and to keep up with vaccines, because that is part of our responsibility with the ARPA dollars. So hopefully we don't have to dig any more into that pot, but that really is a top priority for us. keeping Clark County safe, but these dollars can go a long ways to helping those census tracts that have been hurt for years, and helping the businesses get back on their feet, as well as making sure that we have plenty of vaccines. You know, we have to work on the third shot here real soon. So it's $38,000 per site. So it is, we got a lot of moving parts right now.
Well, I am so glad that you're bringing up vaccines, because that's where we're going next. My favorite topic to work on with you.
Yes.
Just for the viewers at home, I have to say this. So after our last Out in Front episode, Commissioner Kirkpatrick and I had a long conversation about vaccines, and she personally, I would text her when elderly folks or folks in the community needed to get in to get their vaccine, and she was physically making the appointments for me so that we could get those people in. And then sometimes I would even drive those people to get their vaccines. So just a huge shout out to you on the issue of vaccines. You know, I know you get a lot of crap about it. I know you get a lot of flack about it. This should be an issue you're getting zero flack on, because we should all be getting vaccinated. I don't care what anybody says. And I just want to personally say thank you for helping us and our people and our neighbors. I was telling you about my neighbors who you personally made the appointment for, got vaccinated, and then they got COVID a couple of weeks ago. And I believe that saved their lives. That's the only reason why they weren't hospitalized or dead. So thank you.
No, wait, look, I got pretty fast at it. I could do it within 3 minutes.
we had a whole system down. I text you,
We
give me the
did.
confirmations. We were going to town. It was great. So thank you from the bottom of my heart on that. And I'm excited to continue to work with you on vaccines, because it's a topic that's near and dear to my heart. So let's talk about that. What are the next steps for Clark County on vaccinations, and how do we ensure even more folks all around the state, not just here in Clark County, are getting vaccinated? Because that's the only way we're getting out of this.
So really for us in Clark County, we're a little bit different than Washoe. We're a much younger county. We have a lot more younger folks, so it's taking us a little bit longer to get to that group. So across the state, there are some counties who just don't want vaccines, and that is their choice. But they have to be able to maintain their hospitalizations. So I sit on NACO, which is all of the counties. So I try to stay on top of them. We've helped them several times. But for us here in Clark County, we currently have 175 locations where you can get a vaccine. And we know that we have to start with a third shot for one, and for two, we're constantly educating people on what's important. So what I would tell you today, and I want to look at these numbers, so I'm looking away for a second, but today we have a lot to be proud of. We're at almost 58% of our folks are totally initiated. And the reason that number is a little bit low is because the CDC includes everybody. So 0 to 12, and we know they're not eligible, but they're included in our population. But for us in Clark County, 71% of 18 and over are vaccinated. So that was a big milestone. Super excited about that. 16 and over is 68%. 12 and over is 66% of initiated vaccines. And then, so we're at 58, 55, and 56, but in 3 weeks, we should be at those same numbers. So we are making headway, one day at a time, one shot at a time. But we'll continue to do this, and we'll need to do this through the end of the year. But right now, here's what I would say to those so if you got the Pfizer shot and you want to get the third shot, what I would tell you, if you're immunized or if you're immune compromised, please go today to any of those locations and we can give you that third shot. For all the others, we'll start about October 1st. We're laying out the plan now to do all those people from January, then we'll do February. March was our hardest, so about December, we'll be trying to do about 200,000 vaccines. But we can do it. We did it once, we did it twice, we're going to do it 30 times. So.
Yeah, that's a lot of work. I know how much work has gone into this. So, Commissioner, just on a personal level, this is something I know you care deeply about. I know you were telling me your granddaughter has become quite the champion of telling people to get vaccinated. I kind of love that. A lot of kids are excited to get vaccinated. They're scared to go to school. I know that, my mom, who asked you a question, which we'll get to in a bit, our educators, our staff are scared to go to school. What do you tell people who are still hesitant to get these vaccines? Because I know a lot of young people are so excited to get them. And I just don't understand where the hesitancy is coming in from some folks in our community.
So one, we know that they don't want to hear from elected officials, right? They're tired of listening to elected officials, and I'm okay with that. But I do a lot of webinars. So last Friday, I did 15 to give the peer-to-peer, to give them the facts so that they could go out and talk to their friends. So like this morning, I talked to a sports mom where her kids want to do a forum where they just talk to other athletes and say, let's go get vaccinated together, or what information are you worried about? So it really is a peer-to-peer at this point, because a lot of folks that were going to get it, got it. Now that it's FDA approved, we've seen a little bit of an uptick, but at the same time, they want to hear from their friends, their family, their cousins, their coworkers about getting the vaccine and what the pros and cons were. And, everybody has a different experience.
Yeah, it's been really hard for me, if I'm being honest, to be patient, but I've had to be patient because I understand there's some real fears out there. There's also some real hesitancy among, people of color for obvious reasons, things like that. And there are barriers that we have to get over. But, I think if people are being patient and actually wanting to have a conversation with people and educate people who are really interested in getting vaccinated, hopefully those of us in the community can help them, make that decision to go and get the vaccine.
Yeah, so one thing that we did last week, and that is we met with all of the principals via Zoom, and it was a little over 350 people, and we had the doctor on there so we could walk through specifically to their questions, right? Why is the contact tracing the way it is? And it's very complicated, right? There's no cases ever the same. And we talked to them about the importance of why the seating chart matters and why some of these things. So we recorded it. We asked them to share that with their staffs. There was a notice that went out this week that said they should share it with their staffs. And then we made some one-pagers for parents so that they could have some facts from a licensed doctor, from a licensed epidemiologist, so they could read it. And what I would tell you, there's many people out there that don't want their friends to know that they got it. And so if we can give them the right information, then they can secretly go get it.
Well, I'm all about telling people to go get it. I got it. I'm afraid of needles. Get your vaccine. I'm not shy. I'm not shy. I'm one of those people. There was that meme the other day of that guy with all the pins and needles in him. And it's like, give me all the boosters. I am literally that person. Sign me up.
Yep. I remember the day you got it. You sent me a picture.
I did send you a picture and I thanked you for it because I was so excited to be able to get it. It was such a relief. As somebody who has asthma, I was deathly afraid. I'm still deathly afraid of COVID, and knock on wood, I've been exposed, but I haven't gotten it yet. And so, I am very thankful for this vaccine and I can't wait to go get my booster.
Yep. I agree. I'm with you.
All right. So let's keep going. Speaking of, so let's talk about boosters for a second. You talked a little bit about that, but obviously, we're talking about immunocompromised people being able to get it first. Absolutely. Rightfully so. What classifies as an immunocompromised person? What do people need to know about that? And can they just walk into a Walgreens at this point, or one of the shot facilities, and be able to explain their condition and get the shot right there?
So they can, and especially at the pharmacies or any of our locations. Our Station 18 is pretty active. But if you remember, the medically challenged were the last ones to get the vaccine. Remember, we couldn't understand how that worked. But now we know that they're the first ones to get their vaccine. And so the CDC has a list, and it's like HIV, asthma, overweight. There's a list of about 20 items so that you can go and get your vaccine. But here's what I would say. If you truly are not immune compromised, please don't get it too soon, because it's good for 8 more months. And we want to be able to make sure that people can get through the full flu season, which lasts until about March 1st. So you think you're jumping the line, it's going to help you. It likely will get you about February. You'll run out of your 8 months. So we encourage people to be mindful of when they do that.
That makes sense. And then where can people go to get it? So obviously Walgreens, CVS, I know they're advertising shots every day. I've seen it at like grocery stores, Albertsons, you know, the usual suspects, but are there still facilities in Clark County that oh, there's your granddaughter.
Say hi. Say hi.
Hi, everyone. Nice to see you. It's okay. I'll keep talking. So the commissioner's granddaughter just made a special appearance. It's totally fine. We told her earlier that we were kid friendly. So, all right, she's coming back. So what are the other locations where you can go and get your shot? You're like either your initial vaccine or your booster.
So for the booster, we're going to set up some mass drive-through sites. So those will start about October 1st. But if you're immune compromised today, you can go to the Southern Nevada Health District. You can go to any of your local pharmacies. You can go to the fire station, Stan Fulton. So we have a pretty active, up-to-date list that we do every week, and that's on the Southern Nevada Health District. So there are some stationary pieces, but as we move into the mass vaccinations, we're going to do drive-throughs this time because we found that those were better. The weather will be a little bit cooler, so we don't want people getting in and out. And you'll see those sites, they'll be around the valley, and we hope to be able to do 15 to 17,000 a day.
That's awesome. So speaking of facilities, just recently, so I think the last time I got tested for COVID was last February. So things were very different than they are now. So just recently went on a trip to Virginia Beach, came back, wanted to get tested for obvious reasons following the CDC guidelines. I didn't realize that the majority of the testing sites now are also at our local pharmacies. So how is that going to look moving forward, especially if our rates do continue to rise as we get to the fall? Is it going to stay at those pharmacies, or are we going to see other testing locations start to open back up?
So if you remember, Walgreens and CVS got a contract with the federal government to provide vaccines and tests. So we've been able to work with the state epidemiologists and with those two companies, and they will definitely have those open through the duration. So we'll have those for testing, and you do not have to have insurance. So if you don't have insurance, you can still go to get it. We are having some locations throughout the valley. A lot of private sector folks are really stepping up to help us. So we anticipate that testing and vaccines will stay in place until next April.
Okay, great. And then just a reminder for those watching at home, if you have questions for the commissioner, now is a great time to put those in the chat. So just make sure Facebook, YouTube, Twitter, put those in the chat if you have questions for the commissioner, and we'll get to those in just a little bit. I've got a few more questions for her first. So what are the next steps that the county is taking to ensure that the guidelines that came down from Governor Sisolak are being followed? Specifically the mask mandate. I know there's a lot of whining and complaining about people's freedoms being, squashed somehow with wearing a mask, which is the most ridiculous thing I've ever heard. But, talk to us about how we're mandating that masks be worn and what that's looking like in Clark County right now.
So really, we have pretty good compliance, especially with our tourists. And remember that it's just for indoor use, because we know that indoors with ventilation is really what helps spread the virus. So we're having a pretty good compliance. I'll tell you a funny story is I had people at my last county commission meeting who were complaining about having to wear a mask, but they sat there for 5 hours with their mask on. So I don't get it. I just don't get it. 5 hours you sat there so that you could yell at me and you wore your mask the whole time. So what I will tell you is, for those that don't believe that masks work, going from 18.8% down to 13%, that's a definite show that it's working. And I would also tell you that, a lot of our conventions were concerned that we weren't taking it serious. And right now we're at the top of every good list, being out front, we are one of 6 states that are actually going in the right direction.
Yeah, I saw a report on that on CNN the other day. I'm with you. I just don't really get the whole mask squashing my freedom thing. I probably won't ever go back to not wearing a mask, actually. Even just my allergies and my asthma are better when I wear it. And I also don't trust my fellow human. I haven't been sick in over a year, knock on wood. I haven't had the flu. I haven't had anything. And so for me, it just makes perfect sense. And, it's science. You're not breathing in those particles from other people, and therefore you're not getting sick. I don't understand.
Well, and the thing is, it doesn't bother the kids as much as it bothers the parents, right? So the kids, on the first day of school, I attended many schools in my district. They were just happy to be at school and see their friends, and they were willing to wear the mask.
Yeah, absolutely. So lastly, before we move to audience questions, how would you advise those watching getting involved, whether it's about cleaner air, the COVID response, the American Rescue Plan funding, getting involved with helping people get vaccines or boosters? What's the best way that people should be using their time right now? We saw a lot of people get involved last year through food pantries and food banks and really volunteering their time. How should people get involved right now? What do we need most from people?
So really, we like to partner with the nonprofits because we can give them a little bit of dollars so that they can stay afloat. But and then plus it's an avenue for people to stay connected on the issues that they care about, right? There's 38 departments at the county. There's 500 different issues. But if, like we worked, Annette, you worked with a couple of commissioners on the food pantry, and that truly made a big difference. We worked with 3 Square, we worked with some churches, and it really does make a difference. So I just encourage people to be part of the community, delivering with dignity. We've now delivered over 1 million meals to folks that are immune compromised. And so I just encourage people to stay in tune, to watch the county commission meetings. I know they may seem dry, but if you wait till about after 10 o'clock, then that's when we get to everything that's non-consent. And that's really when we start talking about those issues that matter. Mental health, opiates is a really big issue right now. Clark County did not settle for the measly little dollars that they wanted to give us, and working with the AG's office. So the bulk of our juicy stuff to talk about starts at about 10:15 almost every single meeting. So I encourage people to tune in to that so that they can hear what we're working on and to join boards. I mean, we're always looking for people to serve.
Absolutely. That makes total sense. Before we move to audience questions, I just want to note that there was a SCOTUS blog that just came through that the Supreme Court has lifted the federal eviction moratorium. It's an unsigned 8-page opinion with the 3 liberal justices dissenting. And the SCOTUS has sided with a group of landlords who argued that the CDC lacked the authority to bar evictions during the pandemic. So just going to make your work harder now.
I think so. Next week will probably be pretty challenging.
Yeah. Absolutely.
But I mean, I remind the landlords that if you evict them today, we can't pay back rent. So it might be just in your best interest in Clark County to wait.
Yeah, maybe not be a jerk and do the right thing by your people.
Right.
Absolutely. Okay, let's move to some audience questions now with that unfortunate news. So my mother asks, she's a Clark County School District employee. She's an office manager at the elementary school that I went to. So she said, my question is, if a school district employee gets COVID, how is such person allowed to return to work after 10 days without a negative test?
So I don't believe that they're allowed to return without a negative test, even if they're vaccinated or unvaccinated. So that would be something that the principal probably needs to investigate. But I've been on the phone with the principals, and we're doing an every other week update with them. So I can ask that question, how that could have possibly happened. 10 days is, so what we tell kids today is they can return on day 8 if they have a negative test, or they have to wait 14 full days. So unless if they're unvaccinated. So I don't know where the 10 days comes in. So, but I'm happy to find that information out.
Yeah, let me know. I will bring it back for Out in Front next week. And Mom, I'll make sure to get it over to you so you can let your principal know. She said, please ask. She just put it in the chat. I can see it. So she's like,
good.
Please ask. She also said that her kids are never the problem. It's always parents and teachers.
It is.
Yeah. So on the mask situation. So, okay. Our next question comes from Maria. She said, how long does the county have to spend the ARP money? And how will the public be updated on the process of that spending? I think you addressed that a little bit, but how long do y'all have and what does that process look like again?
So we have 5 years for it to be encumbered, and that means completely spent. In 3 years, we have to have it specified to which group. And as I said earlier, we'll be doing quarterly updates, and that's because it's required from the federal government. And really one of the issues that they wanted to know the plans of what people are doing, because what we do know, there are some federal agencies that are just broken, right? They just have not moved with the times. They're really not boots on the ground. And my understanding is they truly want to see new innovative things so that maybe we can move some of those agencies along. So it'll be quarterly. You can tune into Clark County. And I have to suspect that ours will be allocated and spent within the first 3 years. And then year 5, we looked at when we did ours, we factored in when our fiscal year was so that we could make sure we sustain it.
Awesome. Thank you for that. All right. Steve asks, what tactics has the county found effective in combating misinformation about vaccines? We know that misinformation, disinformation is rampant out there right now on everything COVID-19, specifically though about the vaccines. How are you all pushing back against that misinformation?
So Commissioner Jones and I did a COVID conversation. So we were out there, we had doctors on, we tend to do one, we're going to do one with survivors of COVID. We had over 20,000 people listen to that. So people are interested. They just don't want anybody to know they're interested, right? So we're doing a lot of one pagers. Like I said, Dr. Lagon and myself, we tend to do about 10 webinars every couple of days to try and get some of those questions and information. We are marketing to different groups of things that are important to them. And one thing that we know today is that the younger generation is willing to get the vaccine if it means they can go to their favorite concert, right? So priorities, right? So I get it. But so we're doing some of that with the private sector. So we're really trying, and the one thing I say is social media is the worst because people like you and I don't typically respond because it's just so ignorant, right? We just don't respond. But I'm starting to respond so that the people that follow whoever can get a little bit of different information.
Yeah, no, that's absolutely right. The concert thing seems now if they want to go to the Raiders, they got to get it too. So that's helpful. So thanks for that.
Yep.
So the next question comes from Amber. She asks, can ARP funds be used to increase our vaccination rates?
And they are being used to increase our vaccination rates. So whether it's standing up testing, whether it's, I was the only one to vote against the $100,000 in gift cards, just because we've seen that it doesn't move the needle. I was more about maybe we could give the money to the nonprofits and they can get people out. But, we can still use it for different ways. And right now, $38,000 a location, that adds up fast. But, we're always looking for unique opportunities. And the health district is doing some. Anthem started doing gift cards for the high schoolers to play sports. So we're all just trying to find different, unique, creative ways.
Everything helps at this point.
Mm-hmm.
Everything helps. Okay, this one's a really important one. And this is something I also got from my friend Vicky earlier. And I'll expand on it in a second. But Brian asks, will the booster shot become mandatory, and will there be certain groups to get it first, like when the vaccine first became available? So what will it ever be mandatory? And what is I know we know the immunocompromised group, but are there going to be other groups as this roll out?
So we learned some hard lessons last time, right, from different groups. So we've actually been working with the state, the health district, and all the local EMTs. So the immune compromised folks can go today, but then we will start rolling it out based on the month that you got it. So if you got it in December, you'll be the first one to go in October. And if you got it in January, you'll go at the end of October through November. And so we think that's the fair way to go, because a lot of different people got it at certain times. But we also know that 93% of our seniors got it in our valley in the months of January and February. So we want to be prepared for that. Will it be mandatory? No. But what I would tell you is the efficacy rate to protect you even longer is pretty high. So myself, I'll be getting it when my turn comes, just because I want to be safe for the long term.
And I think that's a really important question, Commissioner, around making these mandatory. So I actually just made these mandatory for our workplace. I am a pro COVID vaccine employer. I believe everybody should get it. And if we're out here, talking about people getting vaccinated, we've got to walk the walk. And I think we start to see other employers moving in this direction too, especially now that the Pfizer vaccine is FDA approved. Do you see other entities in the state making these mandatory? Do you see Clark County making this mandatory, the state making it mandatory? Where are we at on that?
So now that it's FDA approved, we have a little more leverage. And we did have a discussion item on our agenda. So I'm not really sure where public employees as a whole will go. But I can tell you that their rate of vaccination is going up. So that's encouraging. So if we could get closer to 70% of the public employees, but there's a lot of pushback from public employees on, I know, crazy, right? On getting the vaccine. So so we know that when it was FDA approved, it was going to be a little bit easier for us to do that. You see that the college students are going to have to do it now. It makes sense. So I just don't understand the hesitancy regardless.
Yeah, and I get it if you have a religious exemption or a documented religious exemption or a documented health concern. Absolutely, nobody's going to force folks who can't get it to get it. It's like the flu vaccine. If you're allergic to eggs, you can't get it. But if you're eligible to get it and you can get it, there's no reason not to get it. And I think it's just it really becomes frustrating to me that people are just following, Donald Trump and the like, which, by the way, friends, Donald Trump got the vaccine back in January. So that's some nonsense too. I don't get this nonsense of politicizing a vaccine that is literally saving people's lives. I just watched it happen last week with my 78-year-old neighbor who had it and was not even hospitalized, has pre-existing conditions. And had they gotten COVID before they were vaccinated, they could have died.
Yep. No, that's a true thing. So today, 87% of the people in our ICUs are unvaccinated folks. And, I've taken some pretty hard calls from parents that their 30-year-old son is on a ventilator and 2 days to live, right? That's pretty devastating for that age group. But as a parent, I could never imagine what it's like to have to bury my child. And people see all these things across the country, and they just think that it's not real. But what I would say to people, what? 2 minutes.
I found it.
Okay, great, thank you. What I would say to people is think about our healthcare workers, because they're tired, they're frustrated. They've been doing this for a very long time. And it's getting harder it's just getting harder for them, so it's not like in the beginning when there was not a vaccine. And, we're one of the richest countries in the world, and to have access to the vaccine, it's just silly to not take that serious.
Yeah, I couldn't agree more. Well, Commissioner, I know your granddaughter desperately needs you for her locket. So what are the things you want to leave with our viewers tonight? How do they get in touch with you? And what do you want them to know that, the county is doing right now on all of this?
So what I would tell you, I'm pretty proud of Clark County as a whole. We've done some amazing work during the hardest times. And one, I just encourage people to reach out to their commissioner. You can always call me at 702-767-1315. If I don't know the answer, I will get you the answer. But really stay engaged in our community, because it's going to be those of us that are standing to kind of pick up the pieces, help with the recovery. And we're recovering today, but it's going to be a slow pace because the rest of the country is blowing up right now. So that will trickle down to us with some of the conventions, but stay engaged, stay involved, and continue to talk to your friends and neighbors about the importance of not only getting vaccinated, but just being engaged in our community, because we have so many new people that really don't understand Nevada, and we really have to educate them that we're way different than the state that they likely came from.
Yeah, I couldn't agree more. Well, thank you, Commissioner, for always being willing to come on. Well, how do people get in touch with you if they have comments, questions, concerns?
So Annette, I will put my cell phone number in the chat. And
you are a brave woman.
I know. I always do. I've been doing it for years, so I think like maybe 500,000 people have it. I work well with text messages. I'm pretty fast with them because I raised my 6-year-old granddaughter, so she keeps me hopping. Or you can email me at my county email, so I'll put that in the chat as well. But don't hesitate to ask questions, because I'm pretty good on getting answers, and I have an amazing staff who will help me find the answer no matter what.
Absolutely. I couldn't agree more. All of our county commissioners are super accessible, and you should take advantage of that, because in other parts of the world and other parts of the country, it's not like that. So highly encourage you to get in touch with your county commissioner. We will put the commissioner's cell phone number and information in the chat. I'm getting that over to my team right now. So please get in contact with Commissioner Kirkpatrick, ask questions, get involved with the county commission meetings, stay involved with where the American Rescue Plan dollars are going in the county and in the state, and ask her questions about where those dollars are going. Or if you need rental assistance, now is the time to ask those questions as well. And she's the perfect person to do that. Commissioner, thank you again for joining us. Thanks for spending some time with us on this Thursday evening while there's a lot of stuff going on right now. And for those viewers at home, thank you again for joining us. Reminder, next week we're going to have, we were supposed to have him on this week, but next week we're going to have him on State Treasurer Zach Conine, who is on the 75 event stop tour. He's going to be joining us from West Wendover next week. And then we're also going to have one of my favorite folks, Representative Dina Titus, joining us. So we're going to be talking all about ARP again next week at the state level, at the federal level. So you're getting all kinds of levels on the American Rescue Plan right now. So that'll be next Thursday at 6 p.m. Again, we're doing it 6 p.m. because Treasurer Conine is calling in from West Wendover. So thanks again for joining us. We'll see you next Thursday at 6 o'clock. I want to remind everyone, we have 2 events coming up next week, really cool events. So first of all, the Out in Front on Thursday, but we also have Shop Talk happening on Thursday with Anwar Green, our organizer. He's going to be going with Senator Dallas Harris to Masterpiece Barbershop to talk about all things ARP. That's going to be Tuesday the 31st at 4:30 p.m. So you're not going to want to miss that. It should be a really cool event. Both events will be on our Facebook page and will be live streamed. So join us for both things. All right, everyone. Thanks again for joining us. Have a great evening. And remember, keep wearing those masks. And now you should get your booster shot. Talk to you all soon.
Thank you.